So while your son is with the nurse getting some tests done, what brings you in today?
Okay, so I have noticed the last couple of days, so it's been like 3-4 days, he's got a high fever, not low grade. We're talking like 102.9, 103.1. Then I noticed his eyes are getting red, his mouth is getting red, tongue's red, and swollen now. He says it feels funny to eat, it's just large. I've noticed like the palms of his hands and even the soles of his feet are turning red now, and I've never seen that before. It was time to come in.
Yeah, I'm really glad you brought your son in today. So what you're describing sounds kind of like Kawasaki's disease. It does present like other diseases, so we will need to rule those out. So he's getting some blood work done, and we'll go ahead and add an EKG and an echocardiogram just to see what's going on.
Okay, EKG, that's heart, right? Like that sounds really scary. So what are we doing?
Yeah, so a Kawasaki's disease is a disease that is inflammation of the blood vessels. It can cause heart disease if left untreated, so it's really good that you brought him in today. So with treatment, it is usually very successful and very minimal, so like a low-dose aspirin and immunoglobulins, which are immune proteins. So you brought him in very early, and so that is really great.
Okay, so I've never heard of this. No one in our family has it. Why did he get it?
Yeah, so interestingly enough, there is no known cause. So you did nothing wrong. Unfortunately, sometimes these things happen. But you did a really good job noticing, so we can start treatment as early as possible.
Okay, so now that I get him home, what do I do?
Yeah, so some of our nursing diagnosis is impaired oral mucosa membrane integrity, as evidenced by the inflammation that you've been telling us about. So you'll want to check his oral, his tongue, all around to see if anything has changed. So you want to keep his lips moist with like a water-based or aloe vera-based chapstick. So he will be in some pain, and you'll want to give him a low-dose aspirin, which will help reduce his pain and also his fever.
Okay, sounds great.